Good morning, I'm Angela Joy M. De Leon, student nurse from Nueva Ecija University of Science and Technology, BSN 3G. And today, I will demonstrate the nasogastric tube insertion. First is what is nasogastric tube. Nasogastric tube, a tube that is passed through the nose and down through the nasopharynx and esophagus into the stomach, abbreviated NG tube. It is a flexible tube made of rubber or plastic, and it has bidirectional potential. It can be used to remove the contents of the stomach, including air, to decompress the stomach, or to remove small solid object and fluid, such as poison from the stomach. An NG tube can also be used to put substances into the stomach, and so it may be used to place nutrients directly into the stomach when a patient cannot take food or drink by mouth. For the assessment, check the doctor's order. Assess the client's level of consciousness and level of knowledge and understanding. Assess the availability and functionality of the needed materials. Check for history of nasal surgery or deviated septum. Assess patency of NAREST. Determine presence of gag reflex. And assess the mental status or ability to participate in the procedure. For the planning, before inserting a nasogastric tube, determine the size of tube to be inserted and whether the tube is to be able to attach to the suction. Next is prepare the equipments. For the equipments, large or small bore tube, non-latex prepared. Non-allergenic adhesive tape 2.5 cm or 1 inch wide. Clean gloves, water-soluble lubricant, facial tissues, glass of water and drinking straw. 20 to 50 ml syringe with an adapter, basin, pH test strip or meter if have, bilirubin dipstick, stethoscope, disposable pad or towel, clamp or plug optional. Anti-reflux valve for air vent if sump tube is used, suction apparatus, safety pin and elastic band, CO2 detector optional. For the implementation, introduce self and verify the client's identity using agency protocol. Explain to the client what you are going to do and why it's necessary. Assist the client to a higher power positions if his or her health condition permits and support the head on a pillow. Place a towel or disposable pad across the chest. Provide for client's privacy by closing the window or the door in the room of the client. Perform hand hygiene and observe appropriate infection control procedure. Assess the client NAREST and prepare the tube. Support the patient during the procedure. Determine how far to insert the tube. Use the tube to mark off the distance from the tip of the client nose to the tip of the earlobe, and then from the tip of the earlobe to the tip of the xiphoid. Mark this length with adhesive tape if the tube does not have markings. Insert the tube. Lubricate the tip of the tube well with water-soluble lubricant or water to ease insertion. Insert the tube with its natural curve toward the client into the selected nostril. Ask the client to hyperextend the neck and gently advance the tube toward the nasopharynx. If the client gags, stop passing the tube momentarily. Have the client rest, take a few breaths, and take a sip of water to calm the gag reflex. Ascertain correct placement of the tube. Aspirate stomach contents and check the pH, which should be acidic. Confirm by X-ray. And place a stethoscope over the client's epigastrium and inject 10 to 30 ml of air in the tube while listening for a whooshing sound. Secure the tube by tapping it to the bridge of the client nose. For the evaluation, evaluate the patient's response to the procedure and document the procedures and other important data on the client's chart.